If you're about to turn 65, you probably have a ton of questions about Medicare. And the more you study, the more confused you get.
Who, where, what, when, why, how, who?
Because it's true, Medicare is ridiculously complicated. And that's why, to make things easier to understand, my team put together the 7 most frequently asked questions about Medicare. And today I'll be answering them one by one. So let's go. Question number 1, when can I enroll in Medicare? Well, if you're turning 65, you can enroll during your initial enrollment period. The initial enrollment period is a 7-month window that starts 3 months before the month you turn 65. It includes the month of your birthday and ends 3 months after you turn 65. If you miss this period, then you'll have to enroll during the general enrollment period, which runs from January 1st to March 31st each year. So take a look at this chart for these enrollment periods. There are also some special enrollment periods that allow you to enroll outside of these regular enrollment periods. For example, if you miss your initial enrollment period because of a natural disaster, you could get a special enrollment period. Or if you choose to stay in your employer health plan instead of switching to Medicare, you also get a special enrollment period when that health plan ends. Question number 2, is it mandatory to enroll in Medicare at age 65? No. Medicare is not mandatory for anyone. You always have the right to decline enrolling in Medicare. However, if you choose to delay enrolling in Medicare past the age of 65 and you don't have creditable coverage, which means insurance that is equal to or better than Medicare, you can incur late enrollment penalties that you will eventually have to pay when you decide to enroll. This penalty is an extra 10% added to your Medicare Part B premium for every year that you delayed. The worst thing about this penalty is that it never goes away. Once you get a late enrollment penalty, you'll have to pay it for the rest of your life. So if you delayed for 1 year, you're going to pay 10% extra every month for the rest of your life. If you delayed 3 years, you're going to pay 30% extra every month for the rest of your life. Now, one common exception for this penalty is if you have group coverage from your employer health plan. If that's the case, you can delay enrolling past 65 as long as that health plan is considered creditable by Medicare. And once you retire and lose your creditable coverage, you'll get a special enrollment period allowing you to enroll in Medicare without penalties. But if you don't qualify for a special enrollment period, I recommend enrolling when you're first eligible for Medicare at 65 to avoid these permanent penalties. Now let's talk about question number 3. What is Medicare Part A? In short, Medicare Part A is the part of Medicare that takes care of your inpatient costs. So if you're ever hospitalized or admitted to a skilled nursing facility, this part of Medicare will help pay for your costs. A great thing about Medicare Part A is that the vast majority of people will not have to pay a premium for Medicare Part A. They will get what is called premium-free Part A. And that's for anyone who worked at least 10 years because you paid for Medicare Part A when you were working. Now, many people still on their employer health insurance plans, they decide to take Part A and not Part B because Part A doesn't have a premium and they might as well have that extra coverage with their employer health plan. So that leads to question number 4. What is Medicare Part B? Well, Medicare Part B is the part of Medicare that assists in covering your medical and outpatient costs. So if Medicare Part A covers you in the hospital, Medicare Part B covers you when you go to the doctor. And pretty much everything else that you think of healthcare usually falls under Medicare Part B, like testing, doctor's visits, surgeries. A lot of these things are actually under Medicare Part B. Now, Medicare Part B covers all types of medically necessary things. However, unlike Medicare Part A, Part B has a monthly premium. And in 2024, the base premium is $174.70 a month. And it's higher if you're in a higher income bracket. Together, Medicare Part A and Part B are what is known as Original Medicare. Question number 5, is Medicare free? No, we wish, right? Even though Medicare Part A is usually premium free for most people, Medicare Part B has a monthly premium. Not only that, but Medicare doesn't cover 100% of your bill. Medicare actually only covers about 80% of your costs. And you're responsible for paying the remaining 20% in deductibles, copays, and coinsurance, etc. Again, let's look at the chart of costs that are associated with Medicare Part A and B, and you'll see that Medicare is not free. Also, remember that there's no limit to how much you can spend out of pocket with Original Medicare. That's why most people who enroll in Medicare also get additional coverage in the form of either a Medicare Supplement plan or a Medicare Advantage plan, which are both provided by private insurance companies to help limit your out-of-pocket risk. All right, question 6. Does Medicare cover prescription drugs? Well, the answer to this is both yes and no. No, because Original Medicare doesn't cover most prescription drugs. If you just enroll in Medicare Part A and B, you will not have coverage for your medications at pharmacies. However, the answer is also yes, because another part of Medicare that covers prescription drugs is called Medicare Part D. Medicare Part D plans are provided by private insurance companies working closely with Medicare. You can enroll in either a standalone Medicare Part D plan or a Medicare Advantage plan that has a built-in Part D coverage. Aside from enrolling in Medicare Part A and B when you turn 65, you also need to enroll in Medicare Part D or a Medicare Advantage plan with Part D so that you have coverage for your prescription drugs. Question 7. What's the difference between Medicare Supplement and Medicare Advantage plans? Oh boy. Okay, so there are a lot of difference between these two plans. Let's take a look at a comparison chart here to explain. In a nutshell, Medicare supplement plans act as secondary insurance to Original Medicare. They usually have higher premiums than Medicare Advantage plans, and they don't cover anything that Original Medicare doesn't cover, which is why people on supplement plans usually also add a standalone prescription drug plan. But with a supplement plan, your out-of-pocket expenses should be relatively low. And you can also go to almost any doctor or hospital in the country because any doctor who takes Medicare will also accept your Medicare supplement plan. Meanwhile, Medicare Advantage plans take the place of Original Medicare. Medicare Advantage plans cover everything of Part A and Part B, and they also have a lot of additional coverage built in, like usually a prescription drug plan and benefits for dental, vision, and hearing care, and oftentimes have other perks like gym memberships or flex card benefits or transportation benefits and many more things. Medicare Advantage plan premiums are significantly lower than those of a Medicare supplement plan, and a lot of Medicare Advantage plans are actually a $0 monthly premium. However, your out-of-pocket expenses when you get your healthcare services are generally higher with a Medicare Advantage plan than with a supplement plan. Also, Medicare Advantage plans usually have networks of local doctors and hospitals that accept their plan. So there's slightly less flexibility compared to a Medicare supplement plan. You'll sometimes have to request referrals to see a specialist or get prior authorizations from an insurance company for major treatments. So what's the better plan? Well, the truth is both of these plans are great in the right situation. It really depends on your needs and your situation, your preferences, your budget, all of those things combined to find which plan is best for you. But if you want more help figuring out which plan is the best one for you, I recently released a comprehensive video on this topic that you can view on my channel. Now, there's one last question I want to address that apparently 7,700 people search for this term on Google search every month. And the question is, are Medicare Advantage plans bad? Well, the short answer is no. 54% of people who are enrolled in Medicare also are enrolled in a Medicare Advantage plan. So it's actually the majority of people. And a lot of our clients are happily enrolled in Medicare Advantage plans. However, thousands of people are still asking this question every month because of the misinformation that exists and that is being spread online, especially here on YouTube. They try to paint Medicare Advantage plans as evil and make it seem that if you get a Medicare Advantage plan, your insurance company will never allow you to see a specialist or get that expensive treatment that you need. And that simply isn't true. The reality is 92.6% of all prior authorizations that were sent to Medicare Advantage plans were approved in 2022. And even if you were declined, the appeal decision in 2022 statistics showed that 83% of the approves were accepted. So that means 7.3% were denied, but 83% of that 7% were later approved. So almost none of them are being denied. It shows that a very small percentage of people don't get treatment because of prior authorizations. And honestly, if we're down to 1 or 2% not getting authorization for their treatment, those are probably the 1 or 2% of hypochondriacs that want treatments for everything. So that's something that the biased salespeople will never tell you. The reason why some people online are so biased against Medicare Advantage plan, in my opinion, is because they're not even certified to represent Medicare Advantage plans in the first place. So getting the certification to represent Medicare Advantage plans is hard. Trust me, I've spent around 60 to 80 hours just this year going through hoops and hurdles and tests and ongoing education to get them. So most of these people that are bashing Medicare Advantage plans, honestly, are probably just too lazy, or maybe they didn't certify, or they just want to do the simple route of selling you a Medicare supplement plan. So instead of giving you the whole picture, they attack Medicare Advantage plans so that you'll buy a Medicare supplement plan through them. So beware of the bias of a lot of agents here on YouTube. who have ulterior motives. As someone who always strives to find the best plan for my clients, it honestly makes my blood boil to see how people can just openly lie on YouTube and all for their personal gain. That's why whenever you see someone so openly bashing any specific plan type, don't trust them. A good agent should help you understand your options in an unbiased way so that you can make the right decision for yourself. That's why I recommend that if you want a complete and unbiased comparison of Medicare Advantage plans and Medicare supplement plans, go check out my full video on this. Other than that, I hope I answered your Medicare questions today. And if you still have more questions, leave them in the comment section below and I'll try to answer them here. Thank you for watching and be sure to subscribe for more helpful and unbiased Medicare content. Bye-bye.